by the munitions expert. Then you should really also have an ancillary surgical site. What's an ancillary surgical site? The idea here is that if you take the patient to your main operating room and something bad happens, your main operating room is going to be down. I'm not sure where the ancillary surgical site would be here, but maybe the MOB, something. This is the Fort McHenry. This is a transport ship that I was on with the Marines. The deal here is this is a ship that's designed for heavy casualties because it drops off Marines and their stuff, and it's ready to accept them back. There's a ton of awesome operating rooms right here in the bowels of the ship. But if you think that the captain of that ship is going to let you take a patient with a live round impaled in him into the middle of his ship, near his engine room, near his munitions, you're crazy. The surgery would be done on the flight deck in the farthest corner possible, probably with some sandbags. And again, I just recall the Haiti case in 2004, where the detonation of the tear gas grenade evacuated the whole hospital. Here's a case where this was an IED explosion in 2010. This is an armor-piercing incendiary bullet. It really has a small amount of explosives compared to the 2 pounds in a mortar, but they got a pre-op CT on this guy thinking this was just shrapnel. He was already in the operating room by the time the radiologist looked at the scout films and said, yeah, you might want to look at that. It's a 14.5 millimeter round. It only has 5 grams of explosives, but still, he was immediately adjacent in the operating room to a life-threatening case which couldn't be interrupted or stopped. And in fact, they had trouble getting supplies to that room because they cordoned off the room. So that's an example where they rushed to the operating room and didn't do it right. Here's a case where just from 2012, this is a Marine with an embedded rocket-propelled grenade in the leg, which they did right. Here you can see these are all just basically blast barriers filled with rubble and sand. They medevaced this guy in. It's actually pretty heroic. Army doctrine tells the helicopter crews that you can't fly a patient with a live round in the helicopter because there's 300 gallons of jet fuel 2 feet away. But the entire crew, 4-man crew of this helicopter, decided that they were going to do it, and they weren't going to do it unless all of them were unanimous. They brought him back to the base, and this guy's a bomb squad guy. This guy is actually a nurse, a Navy nurse, and he was doing conscious sedation while the bomb squad guy pulled out the rocket. You can actually see this on YouTube. It doesn't come out easily. This is a pretty strong guy. He has to really put his back into it and yank 3 times to get that rocket out, and then he walks off camera and takes it to a disposal place. But really heroic stuff. So you do want to isolate from the rest of the hospital. You do, like in Dr. Lewis's case, you want to set up another OR for the surgeon who is a potential patient. Plain X-ray is very helpful, and of course you want to get as much expert advice as possible from whatever bomb expert is close by. They have these suits that you see in the movies, the Hurt Locker, etc. The problem with these suits is that they weigh 80 pounds. And they're kind of, like the Michelin Man. You can't do much. And I'm sure that this bomb squad guy had a suit like that available. You can see he put on a flak jacket and he chose dexterity and mobility over the suit. So for whatever it's worth. Finally, as you may know, helicopters can generate tremendous static electricity. The medics on board helicopters know all about this. It's imperative that the patient be grounded to the chassis of the helicopter, or else there'll be a huge buildup of static electricity, which has a high probability of detonating some of these rounds. This was also in Australia. Australia has like 5 of the 7 most deadliest snakes in the world, and we were very remote. This guy got bit by a snake. We called in a helicopter to medevac him. I always laugh when I see this picture because this was like the only clearing for miles. The helicopter pilot, he knew where to land, but I thought we should set out a flare to help him know where to land. And it was very dry in Australia, and I set the whole field on fire. And then, so that's why I laugh when I see this fire extinguisher in the water here, because we were out, like before he could land, we were out stomping down the fire, and it's great. So the overarching principle is expedient removal, minimal dissection, sharp unblock excision of the round, minimal movement. You really want to keep the attitude and direction and the extrinsic pressure characteristics of the round the same as how it is. Remember that the fuses, even if you don't know the details of the fuses, they're fused by either revolutions, setback switches, pressure sensors. Any axis or positional change should be avoided. So you should basically deliver it to whomever in the exact same way that you found it. And you should avoid touching it at all, and that's what Dr. Dinsmore did with the huge unblocked dissection of the chest wall skin. So that's actually the EOD plant in Hawaii. I guess I did run out of time. I wasn't sure how long it would take, but Dr. Harry Dinsmore Jr. is, he's kind of like his dad. He's very self-effacing, and his dad retired and didn't like talking about his heroics. He came out for Veterans Day parades when asked, and there were a few articles here and there in the paper about him, but he really just retired to Pennsylvania and worked as a solo practice general surgeon. I guess I'm out of time. I'd like to thank Dr. Dinsmore and his wife again for coming here and being with us this morning. It's I think it's really special for all of us to have you here. I told him I wouldn't ask him to come up to the podium, but he said he'd be happy to talk to anybody afterwards who would like to say hello and ask him any questions. I had a chance to hear last night at dinner some personal stories about his father, and it vindicated and confirmed my assessment of his dad as a really self-effacing and heroic individual. And I think, there's the risk of this story being lost to history, and that's why I wanted to share it with you today. I hope that if you found it partially as interesting and inspiring as I have, that it was worth your time. And I thank you for your attention.